We live in an era where even the most familiar things end up under the microscope. Coffee is one of them. This drink sparks many debates. For some, a source of energy and health. For others, a cause for concern about the heart and blood pressure. But scattered opinions are not evidence. What matters is what large-scale medicine shows. And today we will find out what science really says about the impact of coffee on the cardiovascular system, from blood pressure and arrhythmias to life expectancy, all based on major reviews and dozens of leading studies. All scientifically in simple words. Let's go. Does coffee prolong life? One of the largest studies in the UK with almost 500,000 participants showed those who drank 2-3 cups of coffee a day lived longer. Their risk of dying from any cause was 14 to 17% lower compared to those who did not drink coffee. And they were followed for an average of 11 years. And in another study with more than 170,000 participants, it turned out that the more coffee people drank, up to 8 cups a day, the lower their risk of death, even in those who metabolize caffeine slowly. This means that not only caffeine, but also other substances in coffee may provide benefits. In another study, the risk of sudden cardiac death did indeed increase if a person drank more than 10 cups of coffee a day. But the truth is, it is not all straightforward. In one old study back in the 20th century, scientists noticed a possible link between coffee and an increased risk of heart attack. But the data were obtained with methods that do not meet modern standards and later were not confirmed. Already in 2014, a meta-analysis of 36 studies, more than 1 million people, showed that 3 to 5 cups of coffee a day reduced the risk of coronary heart disease and stroke compared to those who did not drink coffee. And data involving more than 6,000 people confirmed that those who drank coffee had less calcium in their coronary arteries, meaning atherosclerosis progressed more slowly, although the statistical reliability was not achieved. This study supports that coffee may slow atherosclerosis thanks to components beyond just caffeine. Should we be afraid of arrhythmias? There is an opinion that coffee causes arrhythmia, but what does science really say? Yes, coffee can influence the heart's function, especially in large doses. Studies show that not coffee itself, but excessive and unusual consumption of coffee can lead to irregular beats in the heart. For example, in an experiment on animals, administration of a very high dose of caffeine, equivalent to more than 15 micrograms per kilogram per minute, caused rapid heartbeat and severe arrhythmias, including ventricular fibrillation. This condition was partially resolved with V blockers. Confirmation can also be seen in the clinical experiment by Robertson, in which 250 milligrams of caffeine, about 2.5 to 3 cups, sharply increased stress hormones, adrenaline and noradrenaline, by 207% and 75% respectively, in people who had not drunk coffee for the previous 3 weeks. Moreover, according to Hisway, the risk of atrial fibrillation was higher in those who drank coffee irregularly, that is, occasionally or with sudden dose increases. But in those who drank coffee regularly, such a connection was not found. In a large-scale study in 2021, scientists found each additional cup of coffee per day could be linked with a 3% reduction in arrhythmia risk. This was especially true for atrial fibrillation and supraventricular tachycardia. Moreover, even genes responsible for caffeine metabolism speed did not affect this relationship. And this is not isolated data. In a 2021 meta-analysis, no link was found between coffee and atrial fibrillation. And Spanish researchers showed that consuming up to 7 cups per week was linked to a decrease in atrial fibrillation risk. And a 2018 meta-analysis confirmed, caffeine and arrhythmias are neither friends nor enemies. No connection. And here is the most curious data from a Danish cohort study of more than 57,000 people. The more participants drank coffee, from 1 to 7 cups per day, the lower their risk of developing atrial fibrillation. The maximum effect was seen at 6 to 7 cups per day, where the risk decreased by 21%. In a randomized controlled trial in 2021, it was determined that consuming 1 cup of coffee in real time did not cause episodes of supraventricular tachycardia in healthy participants. and the study by Notarius and colleagues, 2012, showed that in healthy middle-aged people, caffeine can activate the braking, parasympathetic part of the nervous system and slightly weaken the stress response of the body. However, in people with heart failure, it does not affect heart rhythm or the nerve impulses that regulate muscles. That is, coffee can calm the heart system in healthy people, but in those with heart problems, it simply acts neutrally. Moreover, a randomized study showed that coffee does not increase the frequency of ventricular extrasystoles. Add even a high dose of caffeine, 500 milligrams, did not cause deterioration in patients with severe heart failure. However, at the American Heart Association Congress in 2021, it was stated that in people with very fast caffeine metabolism, drinking more than 1 cup could increase the risk of ventricular tachycardia. But in most, such a link was not found. If you are healthy and drink coffee regularly and in moderation, there is nothing to fear. Coffee does not cause arrhythmias and may even lower the risk, especially of atrial fibrillation. But with very high doses, especially in the unaccustomed, irregular beats may occur. It all depends on context, dose, and individual characteristics. Now let's talk about blood pressure. Some worry that coffee may raise blood pressure. And partly this is true, but only at first. If a person usually does not drink coffee, then after 1 cup, blood pressure can quickly jump by about 8 millimeters of mercury systolic and 6 millimeters diastolic. But if a person drinks coffee regularly, the effect disappears. Regular consumption does not increase the risk of hypertension and is not associated with a higher risk of cardiovascular disease. Cardiology Journal emphasizes, if you rarely drink coffee, pressure may rise slightly right after a cup. But if you drink it regularly, the body adapts, and this effect disappears. Moreover, in some, a slight decrease in pressure is even observed. And also, in postmenopausal women, neither caffeinated coffee, nor decaffeinated coffee, nor caffeine itself is linked to increased risk of hypertension. In other words, for this group, the drink does not pose a threat in terms of blood pressure. The conclusion is simple. For most healthy people, moderate and regular coffee consumption is not a risk, but rather a benefit. Coffee not only does not cause arrhythmias and hypertension, but may lower the risk of cardiovascular disease and prolong life. Of course, with very high doses, especially if you are not used to coffee, short-term irregular heartbeats or elevated blood pressure are possible. But there are reasons for this and protective mechanisms. So enjoy your coffee without fear. Listen to your body and remember, coffee is part of a lifestyle that can be both healthy and enjoyable. By the way, we already have a video about the effects of coffee on other body systems. We invite you to watch. It will be interesting. May your knowledge be beneficial and your health be reliable.